Well, hi, Sarnia Lambton. Today we have a special guest, one of our own, Sarnia native, who was actually born in St. Joe's, where my office is now, Dr. Suman Chakrabarti. He's an infectious disease specialist, works at Trillium Health Science Center in Mississauga. And we are talking to him, we're going to talk to him today a bit about some updates in this whole COVID pandemic, especially in light of the fact that we're going to be entering the fall and the cooler season now, and back to school, etc. So welcome, Suman. Thanks a lot for joining us today in your old town.
Well, thanks so much for having me. It's an honor.
So I have a few questions for you. What's the latest in Ontario now in terms of what's happening with COVID-19 trends and numbers?
You know, we're in a really good spot, actually. Obviously, we're hearing these numbers. It would be awesome if it were zero. But right now, we're averaging about, 80 to 100 cases a day. And at the peak, we were up, close to 500. So, this is a really, really good thing. And I think overall what we're seeing is that even though there's a lot of these new cases, most of them are in young people, which is expected because this is the group that you expect to congregate more than the older population. But the other big important thing is that when you look at hospitalizations, even though we're seeing these small spikes in the cases, hospitalizations have been low and they've stayed low since the beginning. And that's a very, very important thing, which is showing most of the disease we're seeing is quite mild.
That's a good, yeah, it's good to know. We have noticed here in Sarnia as well, a drop in our numbers. We haven't had any patients at the hospital since mid-June, while back in March and April, we had a big peak. And we noticed also the trend that we moved from long-term care home population, older patients who more of them required hospitalization versus now younger people. But nevertheless, it's still concerning since the younger people who are carrying the virus can spread it to somebody else still, right?
Yeah, that's absolutely. And I think it's still important for us to remember that COVID's still with us. But if you look, is that even with certain things, one of the big things in Toronto that happened was this gathering at Trinity Bellwoods. And even with that, this is a big park where thousands of people went together. We didn't really see any rise in the hospitalization. So for the most part, we've been doing a good job. We have to stay vigilant. And I think overall, we're in a good spot with low community spread, which protects all of us in every situation.
Absolutely. And my readings also on talking to various specialists is there's a bit of a difference in terms of outdoor gatherings versus indoor as well, especially with air circulation and risk of infection. Is that true? Or
that's absolutely, what we notice is that with outside congregation, unless you have a group of thousands of people, everyone's talking and yelling, the risk being outside is quite small. And basically, if we look at the clusters that have been described since January, there's basically one that has shown outdoor transmission. So it's very safe outside. That doesn't mean you can't be safe indoors, but you do want to make sure that you're still physically distancing. And any situation you can't do that, make sure you're wearing a mask.
So as we now enter the fall and winter season, things are cooling down. Being Canada, of course, we're going to be starting to move indoors again. And as you know, in a couple of weeks, the schools are starting again, and there's a lot of questions, and people are just thinking about what to do with kids and work and everything else. What advice would you give parents, teachers, and students from a scientific standpoint, and given the low prevalence in our community?
Yeah, when we look, and I want everybody to know is that we in healthcare know exactly how everybody feels. We felt this way in March when the pandemic was on its way. So I think a couple of things to remember is, number one, we have very low community transmission right now. We hardly have any cases. They're there, but there's not nearly as high as they were at the peak. So that means that the chances of any one person having COVID, whether it's school, grocery store, library, what have you, is very low. That's very, very big. The other thing is that remember that when we came in the peak, we had a whole bunch of people returning from March break travel, and it injected hundreds of thousands of cases into the community. We're not going to have that. We have ongoing monitoring, and we're going to be able to pick this up. Any kind of swell that's happening, we'll see it long before we have to go back to a lockdown. And finally, when you look at the things that we're seeing, of course, in school, the risk is not going to be zero. But even with this cohorting, certain students wearing masks and keeping people apart, we're going to substantially reduce the risk of COVID and flu. So I really do think that we're going to see the odd case here and there, but no massive outbreaks. And I'm really encouraged that this is going to go well.
I agree. It's a completely different situation now than March, when we had no idea what the prevalence was in the community. And also, as you recall, we didn't have enough testing kits, or we had some PPE supply issues. Now we're in a different place. We have a better idea of how many people out there, symptomatic, asymptomatic, etc. We have more testing capability. We're testing tens of thousands of people every day, right? So, and we have a better ability to isolate and identify and trace back nowadays than we did in the past. Which is helped by the fact that, as you said, we have a lower prevalence in the community, and hopefully we'll just keep it this way.
Mm-hmm.
So moving forward now over the next couple of years, and what's your feeling and advice to the public? I mean, I have a feeling that we basically need to adapt to this. It's not going to go away anytime soon, since we don't have really a cure or a vaccine. Well, what's your thoughts about that to our people?
I completely agree with that. And the other thing to remember is that we may see a vaccine sooner than I expected. Actually, I was expecting it to be end of 2022, but we might start to see vaccination happening as early as April or May. So the thing is to remember, though, even with vaccination, we expect the vaccine's not going to be 100% effective. It's going to work, but it's going to be more something that reduces the risk rather than takes it away. And I completely agree with you that we have to adapt to this. It's going to be with us. But remember, we have other viruses that are with us as well, influenza, and we adapt to that. So I think it's important for Canadians. We should all think that we're in this for the long haul, but I think we will have effective treatments and a vaccine to help us out. But in the long haul, it's not going to ever be completely eliminated, and we have to accept that and adapt to it.
So concurrent with this, then we'll have to continue our vigilance and with social distancing and avoiding large crowds and all these public health measure advice that we get.
Yeah, I think, physical distancing, as hard as it is sometimes, it's going to be part of our daily life. Masks indoors, and especially, the one thing that I am missing, though, is big crowds, like, concerts and, baseball games. I think that stuff will all be back at some point, but even then, COVID-19 is going to be in our consciousness, but I think ultimately we will be able to adapt to it.
What's your gut feeling? Do you think we'll be back in a couple of years to the way we used to be, going out to concerts and going back to life?
Something, I think life does go on. It will go on for this. Think about the pandemic in 1919. If they were able to get out of that, 1918 actually, if they were able to get out of that, I think we will do the same. Things are going to be hard. We're all in this together, but in the end, I think that we will get back to it, the life as we know it. There'll be some changes, but ultimately it'll be something that we learn to love. And, my big thing is seeing a Metallica concert at some point, and I dream about that day. It'll come sooner than we expect.
So we have to learn how to live with it, risk manage, and keep our guards and move on with life. So, well, Dr. Chakrabarti, thank you so much. It's been really great talking to you again, and would love to see you again in your own hometown one day. And just thank you so much, and stay safe, please.
Thanks for having me, and always great to talk to you guys. And please stay safe, and we'll talk soon.
Okay, thank you.